Lily, let me begin with you. What are we learning about the labor shortage right now as a result of Omicron?
Well, I want to talk about maybe a different spin on the labor shortage. We keep calling it a labor shortage, which I think some people think means that, people are quitting their jobs, they're sitting on the sidelines. What people are doing right now is many of them are searching for better or safer jobs. They're leaving jobs that are low paid or that have really high exposure levels to COVID, and they're finding a better job. So they're not just quitting and, sitting at home. They are looking for a better, safer job. Other folks are having to leave the labor market because their childcare or the education of their children is turning virtual, or in the case of childcare, those facilities are closing. And that ties back to work and wages as well. We're in a situation where childcare workers, teachers, those institutions were already short-staffed. People don't have sick leave. So if they get sick or if someone in their family is sick, they're having to choose between going to work sick and infecting their coworkers and staying home and potentially losing their jobs. That's been a challenge throughout this pandemic. It's been a challenge particularly for mothers and mothers of color in particular. But we're just seeing this spike again with Omicron. And I think over the next couple of weeks, we're going to see those ripple effects again of how the care economy underpins the rest of the labor market in this country.
Professor Spriggs, the country added 20 million plus jobs, I think, or something like that last year. The unemployment rate has fallen, maybe not as low as it was pre-pandemic, but pretty faster than many people thought it would. And yet we still have a lot of workers on the sidelines, as Lily pointed out, or we have jobs asking, unfilled. Why?
Well, I think she hit the right notes in that characterizing it as a worker shortage isn't exactly correct. A lot of things that employers are complaining about is normally in a situation like this, where we still have millions of people unemployed, employers have gotten used to being able to pick up and outcompete their competitors for experienced workers. But in key industries, the disease has had a major impact. As an example, we know from data in California that people in the transportation and warehousing industry had a 26% higher than normal death rate. So part of the problem is we're missing a lot of people who are experienced because they died, among some frontline workers in certain industries. And in some industries like healthcare, the incidence of the disease took many days of work away from the workplace. Nurses had incidents of illness way out of proportion to what employers had seen in 2019 when we looked at the data from 2020. And as we've gone through this year, because we've reopened, a lot of workers have been exposed at work. People with less education, in particular women of color, who have frontline jobs where they deal with the public a lot. Employers are experiencing 2 to 3% of the workforce that's ill and unable to work. Is the solution here, Lily, the idea, the thought being that people are leaving low-paying jobs that feel or are objectively less safe than others, for example, in healthcare or home health aides or nursing home aides or fast food, that those enterprises need simply to pay more and become, therefore, a better economic alternative, even considering what the risks may be?
I think that's at least part of it. Certainly higher wages and more sort of choice over your own schedule or your own work experience and worker power once you're at your job will certainly help in situations like this. But we also sort of face a social problem as well that could only be solved by the government. For example, the United States is one of the last remaining countries in the world that does not have universal paid sick leave. You can imagine we would be in a much stronger position today if we had continued the paid sick leave that was created in the early days of the pandemic as sort of an emergency policy response, that lapsed much too early to account for the Omicron wave of infections. If people had that paid sick leave, they could be better able to make the choice to stay home and protect their employment. And there are other things that, the federal government could do as well. For example, childcare providers are largely owned by women of color. They are really sort of small businesses in a lot of cases. They might not have the budget to pay workers higher wages. If the federal government were able to step in and provide a massive investment in that, in that care, in that work that is done by women of color in this country, the parents who depend on those childcare institutions would themselves be able to go to work.
We have to leave it there. Lily Roberts, William Spriggs, thank you very much.